Welcome. Today we're diving into the world of heart health, specifically focusing on a condition called bradycardia. Bradycardia, at its core, is simply a slower than normal heart rate. While a slower heart rate can be perfectly normal in some individuals, especially well-trained athletes, in others it can signify an underlying problem that needs medical attention. So, what causes bradycardia? The causes are varied. Some are related to the heart's natural pacemaker, the sinoatrial or SA node malfunctioning. This can happen due to age-related wear and tear, heart disease, or even certain medications. Other potential causes include damage to the heart from a heart attack, congenital heart defects present at birth, an underactive thyroid gland, electrolyte imbalances, or even obstructive sleep apnea. In some cases, the cause remains unknown, referred to as idiopathic bradycardia. To understand bradycardia, we need to understand the heart's electrical system. The SA node generates electrical impulses that travel through the heart, causing it to contract and pump blood. In bradycardia, these electrical impulses are either generated too slowly, are blocked, or are conducted inefficiently. This slow heart rate can reduce blood flow to the brain and other vital organs, leading to various symptoms. Think of it like a car engine idling too low. It might struggle to provide enough power when you need it. Bradycardia's prevalence varies depending on the population studied. It's more common in older adults due to age-related degeneration of the heart's electrical system. Athletes often have lower resting heart rates, but this is generally a healthy adaptation to training and doesn't typically require intervention. Certain medical conditions, as we discussed earlier, also increase the risk of developing bradycardia. The signs and symptoms of bradycardia can range from subtle to quite noticeable. Some people with bradycardia experience no symptoms at all. Others may feel dizzy or lightheaded, fatigued, short of breath, or even experience fainting spells. Confusion, chest pain, or difficulty concentrating can also occur. The severity of the symptoms often depends on how slow the heart rate is and how well the body is able to compensate for the reduced blood flow. Diagnosing bradycardia usually starts with a physical exam and listening to the heart rate. An electrocardiogram, or ECG, is the primary diagnostic tool. An ECG records the electrical activity of the heart and can identify the presence of bradycardia and other rhythm abnormalities. In some cases, a Holter monitor, which records the heart's activity over 24 hours or longer, may be used to capture intermittent episodes of bradycardia. An exercise stress test can also help assess how the heart responds to physical activity. Bradycardia can be classified based on the location of the problem within the heart's electrical system and the severity of the slow heart rate. Sinoatrial node dysfunction, also known as sick sinus syndrome, refers to problems with the SA node's ability to generate electrical impulses. Atrioventricular, or AV, block occurs when the electrical signals are blocked from traveling from the atria to the ventricles. AV blocks are further classified into first-degree, second-degree, and third-degree blocks, with third degree being the most severe. Treatment for bradycardia depends on the underlying cause and the severity of the symptoms. If bradycardia is caused by a medication, discontinuing or adjusting the dosage may be sufficient. In cases of severe bradycardia, especially those causing significant symptoms, a pacemaker may be necessary. A pacemaker is a small device implanted under the skin that sends electrical impulses to the heart to regulate its rhythm. Lifestyle modifications, such as regular exercise and a healthy diet, can also help improve overall heart health. While preventing bradycardia entirely isn't always possible, certain lifestyle choices can reduce your risk. Maintaining a healthy diet, getting regular exercise, managing stress, and avoiding excessive alcohol consumption can all contribute to better heart health. Managing existing medical conditions, such as high blood pressure, diabetes, and thyroid disorders, is also crucial. It's also important to review all your medications with your doctor to ensure none of them are contributing to a slow heart rate. The prognosis for bradycardia varies depending on the underlying cause and the individual's overall health. In many cases, bradycardia can be effectively managed with medication or a pacemaker, allowing individuals to live normal, active lives. Recent research focuses on improving pacemaker technology, developing less invasive implantation techniques, and identifying genetic factors that may predispose individuals to developing bradycardia. Researchers are also exploring novel drug therapies to improve heart rhythm and function.